Hello and welcome. On September 8th, 2020, the Centers for Medicare and Medicaid Services, or CMS, issued the updated manual on state payment of Medicare premiums. You may have previously known this manual as the State Buy-in Manual. The manual contains policy, operations, and systems information about state buy-in for individuals who are duly eligible for Medicare and Medicaid. We designed this webinar for state policy staff to introduce 5 key policy topics addressed in the updated manual. This webinar will start with brief background on state buy-in and the updated manual for state payment of Medicare premiums. We will then highlight 5 key policy topics discussed in Chapter 1 of the revised manual. First, we will discuss options for states regarding which Medicaid eligibility categories they enroll in buy-in. We call these state buy-in coverage groups. Second, we will explain a few important buy-in requirements for states. Third, we will describe the situations in which federal financing is available for coverage of Medicare Part A and Part B premiums. Fourth, we will explain how states can use streamlined Medicare enrollment processes to enroll individuals into Medicare Part A or B under buy-in. Finally, we will describe the implications for beneficiaries when buy-in coverage ends and identify options available to help these beneficiaries with upfront premium amounts they owe as they begin paying their own Medicare premiums. First, we will provide some brief context regarding the state buy-in and the updated manual. All Medicare beneficiaries owe a monthly premium for Part B in 2020. That premium is $144.60. Most Medicare beneficiaries qualify for Part A without paying a premium. However, some people who haven't earned enough credits through Social Security or railroad retirement must pay a premium to enroll in Part A. In 2020, the monthly Part A premium is either $458 a month or a reduced rate of $252 a month, depending on the number of Social Security or railroad retirement credits the beneficiary has, if any. Through state buy-in, states pay Medicare Part B premiums each month for over 10 million individuals and Part A premiums for over 700,000 individuals. For someone with income at the federal poverty level, the Medicare Part B premium alone takes up more than 10% of their income. Many of these individuals cannot afford to pay for Medicare premiums and other necessities. State buy-in helps them afford Medicare coverage and frees up more of their limited income for food and housing and other things they need to stay healthy and live independently in the community. Most people enroll in Medicare when they first qualify. Those who don't can only sign up during certain times of the year and may have to pay higher Part A or B premiums for signing up late. State buy-in simplifies the process for Medicaid beneficiaries to enroll in Medicare. The buy-in process allows people to sign up for Medicare at any time of the year without waiting for a Medicare enrollment period. In addition to helping Medicare eligible beneficiaries gain access to Medicare more quickly, this makes sure Medicare pays primary to Medicaid for Medicare covered services, reducing costs for states. Also, when a state enrolls a person in buy-in, the state will not have to pay any late enrollment penalties the individual may have owed on their Medicare premiums. Taking away the late enrollment penalty reduces premium costs for state Medicaid programs. CMS released the manual for state payment of Medicare premiums on September 8, 2020. The final manual revises a December 2019 interim draft and responds to feedback received during a public comment period. We had not updated the prior version of this manual in many, many years, and we know that state programs have grown and changed along the way. The updated manual significantly revises all chapters of the prior version to reflect current statute, regulation, operations, and systems that have evolved over time. The revisions are not new policy. We're just bringing the manual up to date to reflect statutory and procedural changes over the years. We redesigned the content to make it easier for states to discern federal requirements and find information. The new manual is also compliant with federal accessibility standards and fully available online for the first time. The updated manual has 6 chapters. We plan to release Chapter 7, which provides information about buy-in policies and processes for the U.S. territories in the future. As already mentioned, during this webinar, we will focus on 5 key topics discussed in Chapter 1, which provides an overview of the buy-in program and relevant policies. The first key topic that we will discuss today is state options for buy-in coverage groups. States have a few options when it comes to who qualifies for buy-in coverage within a state. State buy-in coverage groups contain one or more Medicaid eligibility categories. Note that while we usually classify Medicaid beneficiaries under, quote, eligibility groups, the manual uses the term, quote, eligibility category to avoid confusion with the term buy-in coverage group. All 50 states and the District of Columbia have a buy-in agreement with CMS that includes the payment of Part B premiums for certain Medicaid eligibility categories. States can select from one of 3 Part B buy-in coverage groups. We will talk about those coverage groups and states' options for Part B buy-in in detail in the next few slides. But first, we want to note that states can only include one eligibility category, qualified Medicare beneficiaries or QIMBs, in their Part A buy-in group. All states can pay the Part A premium if applicable for QIMBs, but they can choose one of 2 methods to pay it. They can pay it under their state buy-in agreement or through what is known as a group payer arrangement. States that include payment of Part A premiums for QIMBs in their buy-in agreements are called Part A buy-in states. Currently, 36 states and the District of Columbia are Part A buy-in states. In Part A buy-in states, dually eligible individuals can enroll in Medicare Part A at any time of the year. States can also streamline enrollment into Part A in certain circumstances, which we will discuss later in this webinar. States with Part A buy-in agreements also never have to pay late enrollment increases for beneficiaries' Part A premiums, even if those individuals enrolled in Part A after their Medicare initial enrollment period. Part A buy-in states also pay the regular, quote, base premium for QIMBs, while group payer states have to cover all late enrollment increases that their QIMBs incur for late enrollment into Part A. We encourage group payer states to consider entering into a Part A buy-in agreement. Those interested should contact the Medicare and Medicaid Coordination Office through the email address listed on this slide. As noted on the previous slide, all 50 states and the District of Columbia include the payment of Part B premiums for certain dually eligible individuals in their buy-in agreements with CMS. But states do have some options when it comes to who they cover under those Part B buy-in agreements. First, all states must cover individuals who receive or who are deemed to receive cash assistance benefits and are categorically eligible for Medicaid. States must enroll their residents in Part B buy-in if they are eligible for Medicare Part B and are also categorically eligible for Medicaid based on receipt or deemed receipt of supplemental security income benefits or benefits through a state supplemental program. While Medicare eligibility is rare among children, states currently have the option to cover children with adoption assistance, foster care, or guardianship care under Title 4E of the Social Security Act under their Part B buy-in agreements as well. In addition to covering individuals who receive or are deemed to receive cash assistance benefits, all 50 states and the District of Columbia also cover recipients of Medicare Savings Program benefits under Part B buy-in agreements. Qualified Medicare beneficiaries receive state coverage for Medicare Parts A and B premiums and cost sharing. Specified low-income Medicare beneficiaries, or SLIMBs, and qualifying individuals, or QIs, receive coverage for Part B premiums only. The main option that states have with regard to their Part B buy-in agreements is whether to cover all other Medicaid eligible individuals, besides those receiving cash assistance benefits, those deemed to receive cash assistance benefits, and those receiving Medicare Savings Program benefits. If a state decides to include all other Medicaid eligible individuals under buy-in, the state must truly cover all Medicaid populations. A state cannot selectively include only certain additional eligibility groups under buy-in and leave others out. We will discuss the financial implications and potential benefits of including all Medicaid eligible individuals in Part B buy-in agreements later in Section 3 of this webinar. If you aren't sure what groups are covered under your state's Part B buy-in agreement and/or whether your state has a Part A buy-in agreement, you should be able to find that information in Section 3.2 of your state plan. If you notice that the information in your state plan does not match your current practices, or you have other questions about your state plan, you can contact CMS at modernizetheMSPs@cms.hhs.gov for assistance. Now we will discuss the second key topic from the Manual for State Payment of Medicare Premiums, key requirements for buy-in in all states. First, states must pay Medicare premiums for every individual who is part of the buy-in coverage group that is covered in the state's buy-in agreement. States may not selectively cover certain members of a buy-in coverage group under buy-in, but not others. Second, buy-in enrollment is not voluntary. The state must enroll any eligible beneficiary in buy-in, and the beneficiary cannot opt out or terminate buy-in coverage. Third, because buy-in enables streamlined enrollment into Medicare, states should not send buy-in eligible individuals to Social Security to apply for Medicare if the state can execute streamlined enrollment into Medicare coverage instead. We discuss streamlined enrollment into Medicare in more detail in Section 4 of this webinar. The Manual for State Payment of Medicare Premiums also presents important information about buy-in start dates. To determine the start date for Part B buy-in, the state must take into account all bases for buy-in membership. When an individual is eligible for more than one Medicaid eligibility category, and those categories have different buy-in start dates, the effective date for buy-in is the earliest buy-in start date. More details about buy-in start dates are provided in Section 1.13.1 of the manual. Buy-in start dates depend on the Medicaid eligibility categories for which the individual qualifies. For the populations required to be in all states' buy-in agreements, cash assistance recipients, deemed cash assistance recipients, and Medicare Savings Program recipients, Part B buy-in must start the first month the individual meets the requirements for buy-in, meaning the first month if they qualify for Medicare and a Medicaid category in the buy-in group. When a state covers all other Medicaid eligibility groups in their buy-in agreement, the buy-in start date for those individuals is the second month after the individual qualifies for buy-in. For example, in many cases, when an individual applies for both SSI-related Medicaid benefits and QIMBY at the same time, and is determined eligible for both benefits, their SSI-related Medicaid benefits may be effective for up to 3 months before the date of application, while retroactive eligibility doesn't apply to the QIMBY benefit. In this case, the state should initiate buy-in on the start date of the individual's SSI-related Medicaid benefits because those benefits start earlier than the individual's QIMBY coverage. In the table on this slide, we have provided 2 examples of an individual who qualifies for QIMBY benefits and full benefit Medicaid. In the first example, the individual qualifies for QIMBY benefits and SSI-related Medicaid benefits, and the SSI-related Medicaid benefits begin earlier than the QIMBY benefits. Therefore, the individual's buy-in start date will be the same as their start date for their SSI-related Medicaid benefits, April 1st. In the second example, the individual qualifies for a non-cash related full benefit Medicaid category, and that Medicaid category is covered under the state's buy-in agreement. Again, the individual's full Medicaid benefits began on April 1, earlier than the Quimby benefit. However, because this individual's full Medicaid benefits are part of the state's optional buy-in group, their buy-in start date will be 2 months after the start date of their full Medicaid benefits, or June 1st. The final set of buy-in requirements that we will discuss in this section are requirements related to eligibility determinations and initiation and maintenance of buy-in coverage. In the next few slides, we describe the standard requirements for redeterminations and buy-in when Medicaid beneficiaries first qualify for Medicare, but note that time-limited changes may apply during the COVID-19 pandemic. First, when a Medicaid beneficiary newly qualifies for Medicare, the state agency must determine whether the individual will continue to remain eligible for their current Medicaid coverage. If the individual will continue to be eligible for a Medicaid eligibility group that is covered under the state's buy-in agreement, the state should initiate buy-in coverage for the individual as soon as their Medicare eligibility begins. If an eligibility determination shows that the individual no longer qualifies under their current eligibility group, the state must consider all bases of eligibility to determine whether the individual may still qualify for Medicaid benefits under another category. If the person loses their current Medicaid coverage but qualifies for another category covered under the state's buy-in agreement, the state should still initiate buy-in coverage as soon as the individual qualifies for Medicare and the new Medicaid eligibility group. Even if an individual will lose Medicaid coverage entirely upon qualifying for Medicare, the state must continue to furnish Medicaid benefits until the individual no longer qualifies, and the state must also provide at least 10 days advance notice of termination of Medicaid benefits, as well as hearing rights prior to termination of benefits. Individuals who are part of the adult eligibility category will no longer be eligible for that category of Medicaid coverage when they become eligible for Medicare. However, states that cover all Medicaid eligible individuals under their buy-in agreement may need to enroll members of this adult category into buy-in under certain circumstances. Specifically, if the state has not completed an eligibility redetermination when the individual becomes eligible for Medicare, the state must pay for Part B premiums for the individual while they remain enrolled in the adult category. During this time, states that cover all Medicaid eligible individuals under their buy-in agreements must initiate buy-in coverage for any adult group members who become eligible for Medicare while they remain covered under the adult group. Now we'll move into our third key topic, federal financing for Medicare premiums and other costs for dually eligible beneficiaries. States can receive federal financial participation, or FFP, for coverage of Medicare Part A and B premiums and other costs for most buy-in coverage groups. Specifically, states can seek FFP for the state payment of Medicare Part B premiums, deductibles, coinsurance, and copayments for cash assistance recipients and deemed cash assistance recipients. States can obtain FFP for coverage of Parts A and Part B premiums and cost sharing for Quimbys, and for coverage of Part B premiums for Slimbys. The state's regular FMAP rate applies to these expenditures. Benefits for qualifying individuals are covered entirely by federal funds administered through block grants. Each state gets a block grant amount each year to cover QI benefits for qualifying individuals, and the state must offer those benefits on a first-come, first-served basis. FFP is not available for other Medicaid eligibility categories beyond those receiving cash assistance, those deemed to be receiving cash assistance, and Quimby and Slimby recipients. However, it may still be cost-effective for states to include other Medicaid eligibility groups in their Part B buy-in agreements, that is, to cover all Medicaid beneficiaries under Part B buy-in. First, covering all Medicaid eligibility categories under buy-in helps to ensure that Medicare is the primary payer for Medicare-covered services. As mentioned earlier, state buy-in simplifies Medicare enrollment processes for individuals, making it more likely that they will sign up. In fact, as a way of maximizing Medicare enrollment, some states explicitly require Medicaid beneficiaries to sign up for Medicare. But you can only require a beneficiary to sign up for Medicare if you cover the cost of their Medicare premiums and cost sharing. This means the only way a state can require a certain beneficiary population to enroll in Medicare is to include those individuals in their state's buy-in coverage groups. In addition, states cannot receive FFP for state Medicaid expenditures that could have been paid for under Part B if the person had been enrolled in Part B. So including these individuals could reduce overall Medicaid costs. For example, if a dually eligible individual who is eligible for Medicare Part B but is not enrolled in Part B needs outpatient care, Medicaid serves as the primary payer. Additionally, the state cannot receive FFP for those expenditures because the service would have been paid for under Medicare Part B if that person had been enrolled. Therefore, the state could end up paying for that beneficiary's outpatient care with entirely state funds. We will provide a detailed cost example of this on the next slide to illustrate this point. The example provided on the slide shows the difference in how much the state would have to pay for a sample outpatient service provided to an individual if they are included in the state's buy-in agreement in comparison to what the state would have to pay for the sample service if the beneficiary was not covered under the state's buy-in agreement and did not enroll in Medicare Part B. As you see in the first column of the table, if the Medicare approved amount for the outpatient service is $400, Medicare will pay $320, or 80% of the Medicare approved amount. That leaves $80 in cost sharing to be paid. In a state that uses a lesser of payment methodology, the state is only obligated to pay up to the Medicaid rate. In this example, because the Medicaid approved amount for the service would have been $350, the amount of cost sharing that would be covered by Medicaid would only be $30. Because our example state has a federal medical assistance percentage rate of 50%, the federal government will end up covering half of the cost of the $30 in cost sharing that the state pays for the service, leaving the state with only $15 in total state responsibility. In the rightmost column of the table, you will see what would happen if the dually eligible individual is not covered under the state's buy-in agreement and does not enroll in Medicare Part B. In that scenario, the individual would be covered solely by Medicaid. The state's Medicaid payment rate is $350, and the state would not be eligible for any federal financial participation because the beneficiary is eligible but not enrolled in Medicare Part B. Therefore, the state would have to pay the entire $350 amount out of state funds. For our fourth key topic, we will discuss how buy-in enables streamlined enrollment into Medicare and how the Medicare conditional enrollment process works for QIMBYs who must pay a premium to enroll in Part A. Before the state can enroll an individual into buy-in, the Social Security Administration must have determined the individual to be eligible for Medicare. Social Security has already determined an individual eligible for Medicare if they are enrolled in either Medicare Part A or Part B. If an individual has not yet enrolled in Part A or Part B, they will need to go to Social Security to apply for Medicare before the state can enroll them into buy-in. However, if an individual has enrolled in either Part A or Part B, but has not yet enrolled in both, a state can streamline enrollment into Part A or Part B under its buy-in agreement, meaning that the state should simply enroll the individual in buy-in without first sending them to Social Security to file for Medicare. We have provided two tables in an appendix to the slide deck for today's webinar that show the different scenarios that states may face in enrolling beneficiaries into Part B and Part A buy-in respectively. Those tables indicate when a state would need to send a beneficiary to Social Security to apply for Medicare benefits before enrolling the beneficiary in buy-in, and when the state would simply initiate streamlined enrollment into Medicare through the buy-in process. An individual must have Part A to be eligible for QIMBY. If a person does not qualify for premium-free Part A, they must pay a premium each month for Part A, either $458 or a reduced rate of $252 before they can enroll in QIMBY. However, most people with incomes at the poverty level can't afford that Part A premium without help from the QIMBY program. To address this challenge, Social Security has a process known as conditional enrollment. The conditional enrollment process enables QIMBY eligible individuals to apply for premium Part A coverage on the condition that they will only obtain Part A if they are determined eligible for QIMBY benefits. When an individual submits a conditional enrollment application with Social Security, their Part A benefits will not begin unless and until they are determined eligible for QIMBY. That way, the beneficiary will not be required to pay their own Part A premiums. CMS considers conditional enrollment into Part A sufficient to fulfill the requirement that an individual be entitled to Part A to enroll in QIMBY. In states with Part A buy-in agreements, the combination of conditional and streamlined enrollment processes can make it much easier to enroll QIMBY eligible individuals into QIMBY and buy-in coverage. First, in Part A buy-in states, QIMBY eligible individuals can enroll in premium Part A at any time of the year. They do not need to wait for the annual Medicare general enrollment period. As previously mentioned, these states also do not have to pay any premium surcharges incurred by QIMBY eligible individuals who do not enroll in Part A when they are first eligible. Additionally, in Part A buy-in states, if a QIMBY eligible individual is already enrolled in Medicare Part B, but not Part A, the state can use the streamlined enrollment process to simply enroll the individual into Part A without sending the beneficiary to Social Security to apply for conditional Part A benefits. In group payer states, states that do not have Part A buy-in agreements, establishing coverage for QIMBY benefits and state payment of Part A premiums is a lengthier and more complicated process. States without Part A buy-in agreements cannot streamline enrollments into Part A. So, if a QIMBY eligible beneficiary is not already enrolled in Part A, they will have to go to Social Security to apply for Part A benefits before the state can enroll them into QIMBY. These individuals can use the conditional enrollment process if they wish. QIMBY eligible beneficiaries in group payer states do not have the flexibility to enroll in Part A at any time of the year, like beneficiaries in Part A buy-in states can. Beneficiaries in group payer states must enroll in Part A coverage during Medicare's annual general enrollment period, which runs from January 1st to March 31st of each year. If a beneficiary enrolls in Part A during the general enrollment period, their Medicare coverage will begin on July 1st, and their QIMBY benefit can begin on or after July 1st, depending on when the state determines QIMBY eligibility. Finally, as mentioned previously, group payer states must pay any late enrollment penalties QIMBYs have incurred. The final topic we will cover today is options for beneficiary relief when buy-in coverage ends. When buy-in coverage ends, a beneficiary's Medicare coverage continues without interruption, and the beneficiary becomes responsible for paying their own premiums. The individual does have an option to terminate Medicare Part A and/or Part B coverage after the loss of buy-in, which they can do through submission of a form to the Social Security Administration. If the beneficiary does not voluntarily terminate their Part A or Part B coverage, they may become responsible for late enrollment surcharges in addition to their premiums, depending on whether the individual's premiums were paid through a state buy-in agreement or a group payer arrangement. If the beneficiary was covered by a state buy-in agreement, they are considered to have enrolled during the initial enrollment period and will only be responsible for the standard base premium. They will not have to pay any late enrollment surcharges, even if they originally enrolled late into Medicare Part A and/or Part B. However, if the beneficiary was covered by a state group payer agreement, they are responsible for the total premium amount, including any late enrollment surcharges incurred if the beneficiary did not enroll during their initial enrollment period. The initial Part B premiums owed by a beneficiary for the first few months after buying coverage ends are deducted or billed by Social Security in an increment of 3 months. This means that the beneficiary may not immediately see the premium reduction in their Social Security payments. The deduction may not occur until month 3 and will then include a deduction for that month, as well as a retroactive deduction for the first 2 months that the beneficiary owed a premium. In 2020, that would mean a deduction of $433.80 from the person's check in month 3. This deduction in Social Security payments can introduce a financial hardship for individuals who have low incomes. Beneficiaries have 2 options to obtain financial relief from retroactive billing of Part B premiums. The first option is to request a premium waiver by submitting a request form to their local SSA office. The link to the form is included in this slide. The second option is to request an installment plan for payments. Beneficiaries can request an installment plan at their local SSA office. More information about both of these options is in section 1.15.2 of the Manual for State Payment of Medicare Premiums. Thank you very much for your attention to today's webinar. Please send any questions about the content discussed during this webinar or about the Manual for State Payment of Medicare Premiums to Modernize the MSPs at cms.hhs.gov. At the end of the slide presentation from today's webinar, we have an appendix with 2 tables that show when states can initiate streamlined enrollment into Medicare under Part A and Part B buy-in agreements.